I didn't really know much about HIV or AIDS. We only hear that AIDS was out there.
I was diagnosed HIV positive on December
I
2000.
know that my partner is HIV positive. After I found out, I felt like, okay, I don't have a life anymore. Where do I start?
It was hard for me because I wouldn't believe I would ever catch it.
I said, wait, if this is positive, it means that I'm going to die from AIDS.
HIV is not just physical, it implies a lot of things. It's emotional.
I think about what people will say out there.
It's how you have to fight with society against the stigma and discrimination.
It is going to affect you so long as you put yourself in its spot.
Each one of these samples represents a patient. Unfortunately, there are still new HIV cases, positive reactive cases found every day. The blue color here represents our positive HIV results. After 16 tested, you can see that 6 of them are HIV positive.
Although it has the smallest population of any Central American country, Belize currently has one of the highest HIV prevalences in the region. Poverty, unemployment, chronic malnutrition, drug abuse, and violence are some of the factors that drive the HIV epidemic.
We feel that we have mostly a generalized epidemic, but we also know that there are certain pockets where we have higher incidence, and obviously we're very concerned about that, and so we are working to find ways to bring down that rate.
While there is much still to be done, in the past 5 years, the national AIDS response has had some success in reducing the spread of the disease.
As a country, I think we've moved out of an embryonic stage in the early 2000s when things were a little bit more haphazard. We were just trying to figure out how we would really approach in a systematic way this issue of HIV. And the last 5 years saw us leave that stage of perhaps confusion and enter a stage in which we tried to establish systems.
In 2010, the Global Fund approved a Round 9 HIV/AIDS grant for Belize to scale up the national AIDS response and to halt the spread of HIV. The grant focuses on bringing critical services to populations at higher risk of HIV infection, such as young people, female sex workers, and men who have sex with men. UNDP has been selected as the principal recipient of this grant.
I do see this partnership between Global Fund and UNDP as the best of both worlds. It's a perfect combination of very global knowledge with very concrete understanding of the challenges in the ground.
The National AIDS Strategic Plan in Belize is complemented by the objectives of the Round 9 grant. Working as the principal recipient, UNDP has identified and is working with 6 sub-recipients selected from government and local civil society organizations.
UNDP in Belize brings this forum for people to come together, respecting national commitment, national ownership.
It's very important that the National AIDS Commission has these high-level international partnerships because that brings in a level of expertise and technical assistance that we maybe couldn't get otherwise.
UNDP brings that experience from not only in other countries that are similar to our situations, but from around the world as an advisor, as a partner.
We also feel very confident that they can assist with technical training and other technical matters as we go along so that we can make the best possible use of the money that we are getting from Global Fund. We can then funnel that down to the groups who are working in Belize on the ground with the people that need that assistance.
What this partnership will do is to strengthen what we are already doing with these populations and expand our reach.
It's important that we do outreaches such as this satellite table that we do because you get a wider view of people that you wouldn't target on a daily basis. At this bus terminal you have people coming in from all over the country and they're passing through, and if it's even just one message you hear, that message might impact somebody's life.
UNDP can and should promote a meeting of ideas. Without this, I don't believe that an HIV problem will be solved.
There's many things that I can do that is very positive. So I'm not going to stay as if that's it for me, no.
We can stop HIV and AIDS from affecting our country, from destroying our country, if we can change our attitude, if we can change our behaviors.
I think about 10 years from now, I'm making plans for my life, for the future.
While there are many challenges ahead, by effectively addressing HIV and AIDS through the collaborative efforts of government, civil society organizations, UNDP, and the Global Fund, Belize can continue on the path to meaningful and sustainable development.